Hello everyone, I'm Rick TC. I'm your host for Seven Rivers Health. Thanks for joining us. This program will focus on several health issues that affect us and our community. We hope this program will help enlighten you about these health concerns along with educating you and helping you live a happier, healthier life. We're focusing today on colon cancer and something about colon cancer, the fact that it accounts for about 20% of all cancer deaths. Today we're talking to Dr. Blake Jones. He's a physician at Franciscan Skemp Healthcare, and he's a gastroenterologist there. Dr. Jones, thank you for joining us. Let's first talk about colon cancer and basically what is colon cancer?
Well, thank you for having me. Colon cancer is a disease where there is growth of cells from the lining of the colon or the large intestine, which is the same thing, sort of the last big tube that the food passes through us on our way out. These cells have lost control. They grow, and unfortunately in the process of growing without control, they can cause a lot of damage, and ultimately if the tumor spreads, it can be fatal.
Why is colon cancer becoming one of the highest, deadliest diseases right now?
You know, I think that we've seen a lot of improvements in the outcomes of patients with colon cancer over the last 30 to 40 years. Certainly, the prognosis for somebody with colon cancer at any given stage is much, much better than it was even 15 or 20 years ago because of advances that have been made in chemotherapy and surgery. I think we're certainly catching more of these tumors at an earlier stage, and that has a big impact on how people do. That's independent of any kind of advances we make in the treatment. But I think we're seeing much more awareness of it because of people like Katie Couric, whose husband Jay Monahan, as you may recall, was diagnosed with colon cancer. And we saw the same thing, I think, in the 1970s with breast cancer. We saw breast cancer move kind of out of the shadows and into mainstream discussion because people were no longer really afraid to talk about it. And that's unfortunately held us back with colon cancer for years. It's sort of an icky part of the body, and I think people are a little reluctant to discuss these things even with their doctors, unfortunately. But now I think we're finally gaining traction, and people are, recognizing that, it might be a little distasteful at first, but by gosh, it's important, and we need to chase this down.
But it is very important because, again, we talk about how it's becoming it is a highly preventable disease, is it not?
Absolutely. We think all colon cancer starts out as colon polyps. Not all polyps are going to turn into colon cancer. The vast majority, in fact, don't. But we have every reason to believe that the vast majority of colon cancers are preventable, not just treatable and not just detectable at an early stage, but we can actually prevent the formation of colon cancer.
And how is that?
Well, we can go and take a look for the precursor or the earliest stage before a cancer even gets started, which is the polyp. And then, of course, we remove the polyp so that it never has a chance to turn into colon cancer.
And the problem, of course, with people, as you said, people don't like to talk about this. They're afraid of this because of the part talking about the colonoscopy, I probably have to say. And the colonoscopy is basically the main way of figuring out whether or not you have colon cancer, correct? Or it's one of the tools.
It's a very important tool in the toolkit, for sure. There are several ways we might go look for colon polyps or screen for colon cancer. And there is a bit of a difference. One of the earliest techniques that was used was to look for small amounts of blood in the stool before you could ever see it with your eye. If you turn around and look at your toilet water and, you don't see any blood in the toilet bowl, well, that's great, but you could still have very, very tiny amounts of blood passing in the stool that you just can't see. There are tests to look for that sort of thing, and initially it was one of the first things that was offered to patients because it's cheap, it's easy to do. The problem is it misses a lot. So these kinds of tests are still available, but there's been a lot more enthusiasm for moving towards colonoscopy because it allows for very accurate determination of not only whether or not you have an actual polyp that has started to bleed, but maybe you have a very, very tiny polyp that is nowhere near actually bleeding, and you snuff this out before it ever has a chance to cause trouble turning into a cancer later on. There are some other approaches to looking for colon cancer. People would, in the past, oftentimes have a barium enema performed, which is sort of like, you know, getting pumped up with a turkey baster, and nobody found that test comfortable, that's for sure. And it missed, you know, a fair number of smaller polyps that we would routinely be able to easily identify with colonoscopy. Virtual colonoscopy has received a lot of press recently, and that's a CAT scan, basically, looking at the inside of your colon, sort of like a marriage between a CAT scanner and a barium enema. Unfortunately, that test does also miss a fair number of the smaller polyps, and it doesn't really allow you to take any polyps off. So if we detect any polyps with any of these other tests, we're more or less obliged to then offer you a colonoscopy anyhow to go and do something about it and take the polyp off.
What's being done at Franciscan, Skemp, and at Mayo Clinic to help patients of colon cancer?
Well, at Franciscan, Skemp, and Mayo Clinic both, we have participation in North Central group, which is a group of doctors that are exploring different ways of treating colon cancer. There's a variety of chemotherapy programs in particular which are being explored through clinical trials, and there's active enrollment in these trials to try and determine what the absolute best treatment is for any given stage of colon cancer.
Treatments for colon cancer, is there a lot, or is it surgery, is it chemo, is it radiation? What's the main ones people maybe have to prepare themselves for?
There are a variety of kinds of treatment available, and I think it's really important for a patient to have the opportunity to review these choices with a treatment team. There are some cases where surgery might not be possible because of a patient's health, but usually surgery is going to be part of the answer for dealing with colon cancer. There are some patients who might not tolerate chemotherapy very well. Maybe they're a little older, maybe they have heart or lung problems that will prevent them from going through that kind of treatment. All of this has to be kind of fleshed out on an individual basis. It's a case-by-case kind of analysis. Radiation therapy is generally only useful for some patients with rectal cancer, which is sort of an entity unto itself. That's a little different from ordinary, if I can use that phrase, colon cancer. The colon is attached to the rectum, but the rectum, because of its anatomy, lends itself sometimes to radiation therapy, but we don't usually see that playing a role in the management of colon cancer itself.
And colon cancer isn't really an older person disease, is it, or is it?
Well, it turns out that 93% of colon cancers occur in people over the age of 50. That still leaves 7% of people under the age of 50 who have who make up the remainder of the patients with colon cancer. It's a little less common for us to see it, but it's not impossible. That's the main reason why, for our general screening guidelines for colon cancer testing, we recommend that patients undergo evaluation beginning at age 50 under most circumstances.
And a family history?
Well, if you have a first-degree relative like a brother or sister or parent with colon cancer, then certainly we would anticipate you'd benefit from being screened earlier. Usually what that amounts to is beginning at age 45, unless you've had a family member who's been diagnosed under the age of 50 with colon cancer. In that case, it's probably a good idea to specifically review that issue with your doctor. You may end up needing to have that test done much earlier than 45. And the rule of thumb is that you should probably be getting your first colonoscopy 10 years prior to the onset of the cancer in that first-degree relative.
So in other words, if you have questions, ask your doctor, right?
Always a good idea.
Dr. Jones, thank you for joining us. We'll be back in a minute with talking about ulcerative colitis.